Hello, my name is Dr. Margaret McLean, and I'm a nuclear medicine physician in the Department of Nuclear Medicine at Kaiser Permanente Santa Clara Medical Center. This presentation has been created to tell you about nuclear medicine and radioactive iodine treatments that may be needed. Radioactive iodine therapy, or iodine-131 therapy, has been used as a treatment for thyroid cancer or hyperthyroidism since the 1940s. It has an excellent safety record. Because iodine is used by the thyroid gland to make thyroid hormone, we are able to use radioactive iodine, or I-131, as a therapy for well-differentiated thyroid cancers or benign thyroid disease such as hyperthyroidism secondary to Graves' disease or a toxic thyroid nodule. When you meet with your nuclear medicine physician, he or she will explain more about how radioiodine therapy works, the precautions that need to be taken, and next steps. Radioactive iodine is taken by mouth and collects in any remaining thyroid tissue, including thyroid cancer cells that have spread to other places in the body. Since only thyroid tissue takes up iodine, the radioactive iodine treatment destroys thyroid tissue and thyroid cancer cells without harming other tissue. As with any treatments, radioactive iodine may cause side effects. The extent of side effects largely depends on the radioactive iodine treatment dose level. Low-dose therapy may not cause any side effects. Most patients experience at worst relatively mild side effects, but everyone responds differently to treatment. Some patients may experience tenderness and mild swelling of the neck, nausea, dry mouth, or a temporary change in the taste sensation. Women are discouraged from becoming pregnant for a minimum of 6 months following radioactive iodine treatment. Female patients may be asked to take a pregnancy test. Your nuclear medicine physician will discuss these possibilities with you. The best way to manage side effects is to know what to do before they occur, and your care team will work with you to prepare for and resolve any problems. There is some flexibility as to when the radioactive iodine treatment can be done. This will allow you to have treatment when it is most convenient for you. When you come in for your treatment, you will meet with your nuclear medicine physician, who will again review the radiation safety precautions and check that all necessary arrangements have been made at your home and at work. The radioactive iodine therapy dose comes in a capsule pill form, and you will swallow the capsule with a drink of water without touching it to your skin. You may then go home. Your doctor will place a small yellow sticker on your Kaiser card indicating the date of your treatment and the dose of iodine-131 given to you. You will need to keep this sticker attached to your Kaiser card for 3 months, and remember to keep the card with you at all times. If you are not already taking thyroid hormone, your doctor will prescribe the medication to be filled at the local pharmacy. The medication is a synthetic version for thyroid hormone and takes the place of natural thyroid hormone once the thyroid has been removed. For patients who are being treated with radioactive iodine for thyroid cancer, about 1 week later you will return to the nuclear medicine department to have another whole body scan called a post-therapy scan. This is done to determine exactly where the radioactive iodine remains in your body. The scan will serve as a baseline for future comparison. Following treatment with radioactive iodine, your body will contain radioactivity levels that will decrease every day. For this reason, some precautions will be needed for several days after treatment to minimize radiation exposure to those around you. Your nuclear medicine physician will create an individually tailored program for you. The details will depend on the amount of radiation required for your treatment and on your lifestyle, both at home and at work. The written plan will help guide you in taking care of yourself and protecting those around you, especially young children and pregnant women. And you will be given detailed instructions to minimize the time you spend in close contacts with such people. We ask that you avoid areas such as schools, workplace, or places of religious gathering. Your doctor will also discuss with you how long you should remain in your room and sleep in your own bed if you are living with others. If there is no other person in your residence, you can continue with your normal activities of daily living and do not need to restrict yourself to your own room. Only when others are at home with you simultaneously do we request that you remain in your own room as much as possible. The majority of radioactive iodine not taken up for treatment will be excreted in the urine in the first 24 to 48 hours. In order to reduce radiation exposure to your salivary glands and bladder, we encourage you to drink at least 1 glass of water every hour and urinate every 2 hours when you are awake. Please flush the toilet twice after each use with the lid down. If urine is splashed outside of the toilet, clean the spill 3 times with toilet tissue or flushable wipes and dispose down the toilet. Men must sit to urinate. Please discuss with your physician if you're currently using sanitary pads, tampons, and/or diapers. A minimal amount of radioactivity is also excreted in the sweat. At the end of your treatment period, please wash your clothes and linens separate from the rest of the family's laundry. A small amount of radioactivity is excreted in the saliva. Use separate eating utensils and toothbrushes. There is no need to use disposable utensils. Do not cook for others. Please let us know if you will have any travel plans in the next 3 months, as a special letter may be given to you to facilitate security clearance at the airport. Lastly, although we ask that you minimize contact with others, you're not in quarantine. A quick hug and a dry kiss are always fine. Although precautions are needed to avoid unnecessary exposure of radiation to others, radioactive iodine is a safe and effective therapy for treatment of thyroid cancer or hyperthyroidism. We hope this video has given you a better understanding of what to expect in the weeks following your radioactive iodine treatment and the role nuclear medicine will play. We look forward to seeing you in the nuclear medicine department. Thank you.